First thing is kind of acceptance. Acceptance is the key. We are doing this, implementing this Namaste program, and in the Namaste program, we have, trained the Anganwadi workers, over 500 Anganwadi workers in North Goa and similar numbers in East District of Delhi. These are our 2 project sites in India. These non-specialist health workers are again screening the children for developmental disabilities. So when they come to know about this condition, there is a denial mode which comes. They say, मेरे बच्चे के साथ कुछ प्रॉब्लम नहीं है, वो ठीक है. उसके बेटे ने भी, उसके पिताजी ने भी बहुत देर से बात चालू की थी, वो भी करेगा कुछ दिनों में. And they do not avail these services. These interventions are, we are going into the community and delivering. We are going to their doorsteps and delivering these interventions. But still, these are free of cost. But still, the stigma associated with this condition is sometimes a barrier when it comes to implementation of such interventions.
Hello and welcome to the India Autism Center podcast. This particular episode is a special one. We are here at Goa at the Purple Fest 2025. And we have with us here Dr. Anup Netravalkar, who's a senior program officer at Sangath. He has a decade plus of experience working on public health on a wide variety of areas. We'll be touching a bit about what he's been doing for autism, for other disabilities, for children in general. And he's going to talk to us a bit about type 1 diabetes as well. Thank you so much, Dr. Anup, for joining us.
Thank you, Nupan.
Dr. Anup, you're representing Sangath on this particular episode. Can you tell us a bit more about Sangath and what Sangath really does?
Yes. So Sangath basically is a public health research organization and been in Goa since last 30 years. And, it is working on various areas, particularly the focus is on mental health, but, even other chronic diseases and even in the field of child development. So it was established in 1996, and since then we have, grown from, where we started in a 1 BHK flat in Porvorim, and now we are more than 500 plus employees. So Sangath Goa is the headquarter, and we have hubs in Delhi and Bhopal as well. And we have multiple other project sites like in Rajasthan, Gadchiroli, Pune. So yeah, we are spread across the country.
And what are the main 2 or 3 areas that Sangath?
Yeah, the main area is mental health, then child development, addiction among adolescents, and even geriatric age group, mental health and geriatric age group.
So you said Sangath has been doing a wide variety of things.
Yeah.
Your main focus area in Sangath that you told me before the interview was that you're doing a lot of work around autism.
Yes.
Now we are, of course, at an India Autism Center podcast. India Autism Center has been doing a lot of work on autism itself in terms of training professionals, developing a center for children, families and children with autism, etc.
Yes.
And there are a lot of people and families of autistic children who watch this show as well.
Okay.
So I'm sure a lot of them will be curious that what is Sangath really doing when it comes to autism. Can you tell us a bit more?
Yes, sure. So it all started in 1996, wherein we, just had the usual care services like diagnosis and other things, like how a typical OPD of a developmental pediatrician would run. Slowly, we came to know that the follow-up rates of many of the caregivers was very, very, less. So we had to do something wherein we could give our care services to all the families having children with various neurodevelopmental disabilities, and of course including autism as well. So we first had to know the prevalence of this condition in the state of Goa. So we had a project by name ARTI. ARTI is of course an acronym. And we found that the prevalence of various disabilities was 12% in the state of Goa. Of course, this study is quite old. The paper was published in the year 2015. And of this 12%, 1% disability was of autism. So then we wanted to know how to improve the care services of these because of course if you see any of the conditions, there is always a gap between specialists in India. The population is so vast that there are long queues in the OPDs you take any condition, you take diabetes, hypertension, there are long queues. So the specialist, there is always a mismatch between the specialist care services. So we kind of adopted a intervention by name PACT from UK. So we took this intervention and we adapted it to the Indian context, and which we called PASS. Since there is a gap in the specialist care, what we did was we trained the non-specialist. Now this was what we call as the task sharing approach. Now in task sharing approach, what happens is the specialist kind of scales up a non-specialist in certain aspects. Of course, a cadre like an Anganwadi worker or an ASHA worker, we cannot think of, delivering the care services what a developmental pediatrician will do. But if we train them on a very low intensity intervention like PASS, so what we did, we trained these non-specialists in Delhi. These were the ASHA workers, and they and they delivered this intervention PASS. Now this PASS intervention is is an intervention. It's a completely play-based intervention where we are focusing on the caregiver. If you skill up the caregiver, she will be able to give this psychotherapy or psychoeducational dose constantly. This is what we intend to do through various
And by caregivers, you primarily mean parents?
Yeah, the primary caregiver. And
Okay.
usually it is the mother who is the primary caregiver in the family. So we skill these caregivers. And these were all play-based intervention. And autism, autism, Down syndrome, these are all conditions wherein we have a challenge. The child faces challenges in communication, social communication. So through the PASS intervention, it was all play-based intervention, wherein the mother has to, basically observe the child, how the child is communicating, understand his communication, and then build over this. So this is what happened in PASS. And then we even felt there were some deficiencies in this intervention, wherein these interventions were not addressing the co-occurring concerns of autism. Okay, for example, the toileting issues, sleep patterns, eating patterns. So we introduced another component called as plus component. So it was called PASS Plus, and we even ran a trial, a pilot trial in Sindhudur, wherein the non-specialists again delivered this intervention to the families.
Right.
So we built over this. So and then we implemented one of the largest clinical trial, you can say, in South Asia, called as Compass. And we are still awaiting the results of this trial. So this was one. And based on all this work, we have now started the Namaste program. Now, Namaste program is basically an implementation science. Implementation science basically is, we know that there are interventions. One is your PASS Plus, and one is the WHO-CST. Now, these both interventions are kind of evidence-based or evidence-informed, you can say. And we are kind of trying to understand how do we implement this in a real-world setting. So that is all about the implementation science is all about implementation research, what you call.
Can you tell us a bit more about the Namaste program, because it seems very interesting?
Yes. So Namaste program is a 5-year-long grant, and we are implementing this program in partnership with University of Manchester. So we have also collaborated with other sites, that is Nepal and Sri Lanka. So in Nepal, it is Autism Care Society Nepal, and in Sri Lanka, it is Sri Lanka College of Pediatrics. So these are our key collaborators as well. Dr. Gauri Diwan is the developmental pediatrician and is leading this program in India.
Right. Dr. Anup, you've also been implementing this program called WHO-CST. Can you tell us a bit more about it, please?
Yeah, sure. So World Health Organization has come up with a program called Caregiver Skill Training. Now, this is a transdiagnostic intervention, a transdiagnostic training program to skill up the caregivers. So these are implemented as group sessions. So there are altogether 12 sessions, of which 3 are exclusively home based and 9 are group sessions. During these sessions, we train the caregivers on how to improve social communication of the children. Now, this particular training package is transdiagnostic. We do not require any diagnosis as such for this particular for any caregiver who want to take up this course. The moment you recognize that there is a developmental delay, you can the caregiver can very well opt for this course. So in this course, it is again a play based intervention, and through play activities we train the caregivers on how to improve social communication of their children. This is one aspect. Secondly, we also train the caregivers on how to do the activities of daily living, how to get it done. Because many a times, simple thing like brushing teeth or bathing the child, the caregiver faces a lot of challenges. Also, what is addressed through this program is the challenging behavior of the children. So you will often see that children have certain challenging behavior like throwing tantrums, crying loudly, throwing things from their hand. So what should be the caregiver's approach, when they observe such behavior in their children? So these are the things also being covered through this training package. Also, you know, it is quite stressful to the caregiver to handle a child having neurodevelopmental disabilities. So here there is also a module of self-care in this particular program. So that takes care of parental well-being as well. So yeah.
That's very interesting. I'm sure there are a lot of mothers of autistic children
Yeah.
who are watching these episodes as well.
Yeah.
Could you give 2-3 quick tips to them on how can they be better mothers based on your program?
Yes. So I think all parents put same efforts, so that there is some they try their level best, I would say, to take care of their children. But there are of course frustrations that creep up when they do not get the expected results. So first thing is kind of acceptance. Acceptance is the key. There are many, we are doing this, implementing this Namaste program, and in the Namaste program, we have, trained the Anganwadi workers, over 500 Anganwadi workers in North Goa and similar numbers in East District of Delhi. These are our 2 project sites in India. So these non-specialist health workers are again screening the children for developmental disabilities. So when they come to know about this condition, there is a denial mode which comes. They say, मेरे बच्चे के साथ कुछ प्रॉब्लम नहीं है, वो ठीक है. उसके बेटे ने भी उसके पिताजी ने भी बहुत देर से बात चालू की थी, वो भी करेगा कुछ दिनों में. And they do not avail the services. These interventions are we are going into the community and delivering. We are going to their doorsteps and delivering these interventions. But still, these are free of cost. But still, the stigma associated with this condition is sometimes a barrier when it comes to implementation of such interventions. The mothers the caregivers, I would say, should pay more of attention on how the child is communicating, how the child is playing, what is more interesting to the child, what motivates the child. So these are the key areas, the parents should focus and, channelize their energy in this direction, I would say.
Right. And what do you think society as a whole can do to make itself more inclusive to people with autism?
The society, I have still observed in many places, when a child with some disability, maybe autism or anything, they will keep staring at the child. अरे ये क्या ऐसे behave कर रहा है? ये क्या चिल्ला रहा है? So I'm saying even in the educated class, people tend to do these things and use certain insensitive words I have seen many educated people also using some insensitive words towards such children.
So you're saying changing attitudes is something.
Changing in the attitude of the general public is a must. And, we are creating awareness around this as well in our own way. Means whenever there are certain days, autism
Right.
awareness days, we kind of have some activities around this as well.
What do you think can the government do to encourage this change in attitude?
The school curriculum can be, have something around these things on disability aspect as well. So that could, change the attitude of
At a young age for
at the
people?
young age itself. Yeah.
Right.
So
Okay.
changes in curriculum of the school
Right.
can be very beneficial in this regard.
Any other parting words for our audience before we wrap up this episode?
Yes, I would say that whenever any professional kind of brings these things to your notice of the caregivers, the caregivers needs to take these things seriously, and they have to follow the professional advice.
Right. Thank you so much. Thank you so much for joining us on this episode.
Yeah.
Thank you.